The streets are quiet outside Denver Health Medical Center. The November chill has set in, but don't be mistaken, this hospital is very busy.
We're really scraping the barrel at the moment. The ratio of patients who are critically ill this time is somewhat lower, but I need to be very clear that people that are critically ill are easily as sick, if not sicker, than the first go-round.
We spoke to Dr. Ivor Douglas during the first COVID-19 surge back in April.
I can only reflect on it being a all-consuming, terrifying process.
Now another wave of patients is flooding medical facilities in Colorado and all across the country.
We are at the highest point in hospitalizations in the course of this pandemic.
Up to 1,600 in this state, a record 80,000 plus in the U.S.
In the last few days, we're seeing more and more acute COVID-19 illness in our facilities.
Dr. Stephen Cobb manages 8 hospitals for Centura Health.
Some degree of exhaustion and sadness is the prevalent mood.
Dr. Ahmad Rashid runs the intensive care unit at Swedish Medical Center. 86% of ICU beds are now filled statewide. Hospitals are better prepared to treat COVID-19 during this surge than they were during the spring. No shortage of personal protective equipment and ventilators, more therapies, and more is known about the disease. The challenge now,
Very clearly staffing.
nurses and clinicians, some of whom have contracted COVID, are in short supply. They're mentally taxed as well.
What is quite striking is how worn down people are emotionally.
Caring for patients who are consumed with fear is not easy.
These people are there alone, sometimes confined to a room where they cannot see a familiar face for weeks. That wears on everybody.
A hospital buddy plan is in place in Colorado should the COVID surge get worse.
When one hospital gets full, they call their buddy, and their buddy will take their transfers, their overflow. It's bi-directional, and so patients can go back and forth from rural to urban and urban to rural as need be.
With long lines for testing, COVID cases, and positivity rates all on the rise, experts are not shy about saying the public needs to take precautions. Everyone needs to buckle down for the months ahead.
We're going to get there. It's not going to go on forever. So let's use that to take courage to get through this current time and make the right choices.
A Thanksgiving over Zoom is far preferable to a Christmas in my ICU lying on your stomach on a ventilator. The more we can hammer that message home, the better.
In the meantime, he and his colleagues are working overtime to try to stop this latest surge in its tracks. Hendrik Sabrandi, CGTN, Denver.